Welcome to the 10th Annual New York eHealth Collaborative Gala and Awards. This evening is about leadership, vision, and innovation that improves the health and lives of communities across our state as we celebrate those who have championed these efforts and helped make New York a leader in using technology to improve healthcare.
On behalf of the NYeC Board of Directors, I thank each of you for joining us. NYeC is fortunate to boast strong partnerships across the state and country with organizations that value HIE and its ability to help transform healthcare.
Speaking of partnerships, NYeC is able to help lead the success of this integral network, thanks in large part to the work of our QE partners delivering services across the entire state. And finally, thank you to each of our generous sponsors who have helped make tonight a success.
We are thrilled to be celebrating three amazing leaders this year. These are three individuals that are doing incredible work within the healthcare community to improve the lives and care of countless New Yorkers.
Health information exchange across New York State was a concept that I and others began advocating for long before NYeC or this network became what they are today. Clinical information sharing between care providers is absolutely critical to quality and to informed care delivery. As I leave this board, the shiny New York boasts participation of every single hospital in New York State and well over 100,000 healthcare professionals. It is all this that led to the exchange in New York being one of the leading efforts in this area in the country. My parting hope is that others will continue to support NYeC, the shiny New York, and public health information exchange within the state.
I dedicate this award to our phenomenal frontline workers and other health professionals who, in nearly the last 2 years, have shown us what it means to come together in the face of a crisis. Some of you may know that SUNY Downstage Teaching Hospital, the University Hospital of Brooklyn, was designated as a COVID-only hospital during the run-up to and through the apex of the pandemic. During the height of the pandemic, there were approximately 300 coronavirus deaths in the 2 immediate zip codes where we operate. Of that, 89% were Black, 61% had more than one comorbidity, including hypertension and diabetes, thus underscoring the importance of access to quality medical care for chronic illnesses in a community with such significant health disparities. I'd also like to acknowledge our many friends and partners in healthcare. Tonight's Gala and Awards event is an important reminder of how vital those collaborations are. Because in the end, we all want the same thing: healthy people with access to quality health care resulting in longer life expectancy.
2021 has been an eventful yet challenging year with the continued COVID pandemic. Through it all, our health system was able to embrace these challenges, meet it head on, and rise above it. The one area I'd like to specifically highlight is addressing health disparity and equity. COVID-19 has brought the systemic health and social inequities to light and highlighted the key gaps that our communities continue to face. Our overall patient digital access and experience strategy has a heavy emphasis on equitable access and care and looks to enable equity through infrastructure, addressing digital literacy and engagement, and designing technology with equity in mind. I was especially proud to be part of the Mount Sinai organization when we took a public anti-racist stance and pulled together a committed task force to develop a roadmap. Health disparity and equity will only increase in importance, and all health systems need to acknowledge, solve, and commit to equity-based healthcare. I will continue to strive to make a positive difference for the health system, our community, our patients, our family and friends, and for you. Thank you all again.
You may or may not be aware that our esteemed CEO, Val Gray, is moving on to a new chapter at the end of this year after over 5 years of leading NYeC and the Shiny with clear vision and unmatched determination. The NYeC team, the board, and the full Shiny enterprise will feel her loss deeply. But we are undoubtedly positioned for success in the future thanks to her time with us. Val, from all of us, we wish you nothing but the best of what's ahead and thank you with sincere gratitude. It's been a great pleasure to serve as your board chair.
John, it's been a privilege to work with you. I've admired your long-standing commitment to HIE, your dedication to your CDPHP members, and your continuous innovation. So this will be my last gala. I have been honored to have served as NYeC's leader for over 5 years. Our work has always been a team sport. Thank you to the NYeC staff. They are incredible. And to our state partners, the board, the QEs, stakeholders, and well, the entire health ecosystem. Keep doing amazing things. Farewell, and I'm sure our paths will cross again.